guys, I am Malina Huda Laely. I am a nutrition department of Health Polytechnic Semarang. Today, I will present about how our mobile application currently being used to help individual with megaloblastic anemia eat a healthy diet. Before further discussion, I will show that the frequency of megaloblastic in Nigeria and Africa is high in the country, with the malnutrition, SRAM, and routine vitamin supplement for elderly and pregnant women is not available. Incorrect food preparation and increased demand for folate during pregnancy are the most common cause of megaloblastic anemia. About 1 in 7,500 people develop pernicious of anemia is the US per year, but this has been changed by currently dietary fortification and vitamin supplement in elderly patients in the US. International statistics show that the pernicious anemia and folate deficiency usually occur in individuals over 40 years of age, and their prevalence increases with the older population. According to the Ministry of Republic Indonesia, the prevalence of anemia in Indonesia is 21.7%, and the woman is the higher than the man. There is no specific report on the prevalence of megaloblastic anemia. Before further discussion, this presentation will be in the 4 parts. The first is introduction, second is sign and symptom, the third is diet for megaloblastic anemia, and the last is mobile application used to help individuals with megaloblastic anemia eat a healthy diet. The first is the introduction. The frequency of megaloblastic is high in the country where malnutrition is rampant and routine vitamin supplement for the elderly and pregnant women. What is megaloblastic anemia? Megaloblastic anemia is one form of macrocytic anemia in which the red blood cells become enlarged and oval shaped. It caused by impaired of DNA synthesis, the deficiency of vitamin B12 or cobalamin, and folate deficiency, and abnormal in peripheral blood smear or macrophagocyte and bone marrow sample of megaloblastic hyperplasia. In India and other developing countries, most cases of megaloblastic anemia are caused by a nutritional deficiency of folic acid, vitamin B12, or both. Pregnancy and lactation, alcohol, medication, infection, pernicious anemia due to intrinsic factor deficiency, and malabsorption are the other emerging of megaloblastic anemia. Then, the pathophysiology of megaloblastic anemia is ineffective erythropoiesis secondary to intramedullary apoptosis of hematopoietic precursor cell. Then, both folate and cobalamin deficiency ultimately lead to the medullary deficiency. And the etiology of megaloblastic anemia is an imbalance between folate demand and intake and poor absorption of the cobalamin in the digestive tract. The sign and symptom of megaloblastic anemia is the paralysis of the hand and feet, loss of proprioception and loss of vibratory sense, symmetrical and regressive fatigue and affective weakness, loss of deep tendon and reflex, irritability and mental status change or megaloblastic madness, memory disturbance and fatigue, weakness, glossitis, gastrointestinal problem or diarrhea, decreased appetite, change in taste, and weight loss. For the diet of megaloblastic anemia is the adopt a balanced diet, consume the high protein and high vitamin B12 and folate, supplement vitamin B12 and folate, avoid alcohol and antagonists of the supplement or food with vitamin B12 or folate. This is the application that can help individuals with megaloblastic anemia can eat a healthy diet. The name of the application is Anemia Care Diet and Nutrition. This application has facilitated to directly contact dietitian if you want to consult your diet and nutrition related issue, and can also get your personalized diet chart as per your case and body parameters. You can also consult the dietitian for your query. This application shows the anemia with the cause, the sign and symptom, the type of anemia, the food to eat, the food to avoid, and the diet that can be used to the one day and other. This application we can use in the daily to know our consume of the vitamin or iron and other. This is my reference I get from journal and blog and other. And before I close my presentation, I can say that the healthy start from ourselves and healthy lifestyle is the most effective medicine. This is the application. The name is Anemia Care Food and Diet. We can start the application. Yes, the menu is the what is anemia, anemia cause, the type of anemia, anemia symptom, anemia treatment, preventive of anemia, anemia diet, low platelet count, food to increase blood platelet, important herb of anemia, cause of anemia, risk factor of anemia, diet plan for patient having anemia, 7-day diet plan for anemia, food to eat, food avoid, tips to prevent anemia, home remedies for anemia, yoga process for healing anemia, best vegetarian iron-rich food, best non-vegetarian rich food, stop ads, order diet chart. We can also consult our dietitian with dietitian. This menu is very perfect, yes, but there is the menu that locked and must be buy. We can get the information from the menu. Example is what is anemia. This is information is complete. Then the anemia treatment depend on the iron deficiency, vitamin deficiency anemia of chronic disease, aplastic anemia associated with bone marrow disease, hemolytic anemia. This application can use to individual with anemia megaloblastic. Thank you for your attention. I think enough for my presentation. If any question, you can leave a comment below. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye.